We see apiculate waveforms at a higher frequency, in this case 14 Hertz, followed by a couple of broader discharges which are much slower at 6 Hertz. This is how the name 14 and 6 comes. If we look at the sharpest component of these waveforms, we can see that it is downward deflected. This means that this is a positive polarity, and hence the name 14 and 6 positive bursts. If we look earlier in the page, we get a better sense of the mixture of 14 and 6 Hertz discharges. Focusing in this area, we see that initially there is the higher frequency arch-shaped 14 Hertz waveforms, but then there are broader waveforms that are at 6 Hertz. These are sometimes notched in the middle, where you can see what is probably the remnant of the 14 Hertz waveform. This is probably because of harmonics of two different waveforms which are superimposed on each other. And once again, it becomes easy to understand how the name 14 and 6 arose. One of the other names that has been given to this type of waveform is ctenoid. This comes from the Greek word for comb. It becomes easy to see how the people who first described this waveform arrived at this name. If we look at these runs of waves, we can easily see how they superficially resemble a comb. 14 and 6 Hertz positive bursts are thought to be benign and not associated with epilepsy or any other neurological disease. They are most common in young people and probably peak in adolescence. They are less frequent as patients get older. As I mentioned before, one of the most important takeaways is to better characterize these bursts by switching montages. I would strongly recommend using a montage that has a distant reference, such as a contralateral mastoid montage, to best